Hi, learners. We are continuing on our understanding opportunities journey, understanding and identifying opportunities. Today, we are bringing to you a very upcoming sector, healthcare in India. And I could not think of anybody better than Rizwan Koita to actually speak about his own journey doing a healthcare startup. Rizwan's startup is called Citius Tech. It is a startup that offers digital transformation to hospitals, insurance companies, and so on. Most of their customers are based in the United States and in Europe. I know Rizwan because we were at IIT Bombay together. After his 4 years at IIT, Rizwan went to MIT in the United States and then worked as a consultant with McKinsey. He always had the desire to make an impact, and the first thing that he did was, after leaving McKinsey, did two startups which he scaled. The first one he scaled and sold. It was called Transworks. He then did Citius Tech, which was one of the early unicorns in India. I think it was number 23 or number 25 in India. He was co-founder and CEO of Citius Tech. A few years back, he decided he wants to do larger impact, and therefore he and his wife Rekha Koita started a foundation called the Koita Foundation, and they operate at two ends of the spectrum. One is on the policy level, where Rizwan does a lot of work in policy regarding healthcare, regarding digital healthcare. He's the chairperson of NABH, which is the National Accreditation Agency for all the hospitals in India. He's on several boards. They are also involved with grassroots training for non-profits and agencies that work in healthcare at the semi-urban and rural level. So impact both at the thinking level and the actual execution level. I joke with him that ये तो आपका retirement था and you do more work than you have ever done before. You're working harder than before. He says, I've never been happier before. Without further ado, I'm going to present Rizwan. He's going to talk about his journey as an entrepreneur. And then I will come and use a presentation of Rizwan's to talk about the healthcare opportunity in India.
Thank you very much for inviting me to speak for the tech entrepreneurship session today. Look forward to sharing my thoughts and experiences with all of y'all. Unfortunately, when I became an entrepreneur about 25 years back, we didn't have this course. So I'm happy to share my learnings and experiences, and hopefully it'll help some of y'all as y'all chalk out your entrepreneurial journey. From my perspective, I started a firm called Citius Tech in 2005. And that company started off as a 3-person startup. And today the company has done quite well. We are about 9,000 professionals and close to 500 million in revenues. And I ran the company as the founder and chief executive from 2005 till the end of 2021. So it's about 16 years before I stepped down. And I wanted to share some of the interesting highs and lows of the journey with you today. And hopefully some of those experiences will help you as you do your course in becoming a tech entrepreneur. The journey started in 2005. At that time, we wanted to set up a technology services company focused on healthcare. And in 2005, the idea of having a tech services company in healthcare was a new one. Although there were many other large technology services companies like Infosys, Wipro, TCS, who even in those days, while obviously smaller than what they are today, were still quite formidable listed companies. But we felt that there was a clear business opportunity to focus on the healthcare sector and build a successful technology services company. The first couple of years of the company, because we were getting started off the ground, bootstrapped, were quite slow. We happened to win a few customers. But by the end of second year, we had actually acquired a little bit of scale. And that was around the time when we got the first jolt. My largest customer at that time, which was almost 40% of my revenues, got acquired by another company in the US. And at that point, the new owner of that company decided that they wanted to have a different set of partners. So we took a meaningful beating and in our business volumes, and we had to reestablish a relationship with the new buyer, which finally became quite successful. But there were several months of significant pain. We fast forward another couple of years, and by the fifth year, we had grown larger. And at that point, we had a service delivery issue, something that we should have probably done better with my client, who at that time was my largest client. And once again, it was a very big escalation, and we had to literally do a root cause analysis of where the problems were coming from. And we had to rewire the way we were running the business to ensure that we never encounter a situation like that. Yeah. The business continued to grow, and by the time we were in our eighth year, we felt that we had funded the entire business through internal accruals. And we wanted to bring in an external investor. So we ended up looking for funding, and we got a really good deal from one of the top private equity firms in the US, General Atlantic. And we had stitched the entire deal with General Atlantic, and we were on the verge of signing the paperwork. We had already had a term sheet in place. We didn't have the agreement as yet. And there is a certain period of a few weeks between the term sheet getting signed and the agreement getting signed. And in that period, three of my largest customers, and this was around 2008 when the US economy was going through its ups and downs, had very poor results. And because of that, they had to really cut down on their technology spendings. And here was a situation for Citius Tech, where I had a signed term sheet. I still didn't have an agreement. And the deal was all stitched together, and we were on the verge of signing the contract in a few days. And I got this terrible news from three of my really big customers. And when that happened, we felt that morally we should inform the new buyer or the new investor in the company. So I set up a breakfast meeting the day before we were going to do the signing of the agreement, to just let the new buyer or the new investor know that the company has had this bad news. Yeah. And I was almost sure that with the news that he would hear, he would have two minds on whether he would want to continue the investment. But fortunately for us and fortunately for them, they continued with the investment on the same terms that they had agreed earlier. And finally, the story has a happy ending, because at the end of 5 years, General Atlantic ended up making a 3x return on their 100 million plus investment in Citius Tech. And that was a really, really strong investment for them. And we had a terrific run with General Atlantic. So it was a wonderful relationship. Yeah. In addition to some of the examples I've given you, which are more client related, there are many other stress points which happen during the course of starting and scaling a company. And these stress points could be because of the fact that you may have hired somebody senior and the person suddenly decides to quit because he or she gets a better offer, and that creates a dent in the organization. There are times when the high stress within the organization can cause team issues which need to get resolved. There could be stress points with investors that happen, especially at times when the company may not be doing as well as may be required. There could be stress points related with external factors, right? That the economy is going up or down, or there could be something which could be a political event which causes changes in either the customer strategy or something happening in India, perhaps, which cause a problem. So each of these stress points can create a lot of challenges for the management team, especially for the entrepreneur and the CEO of the company, where he or she may often have to deal with some of these issues at a personal level, uh, often not being able to bring many of the other team members, just given the sensitivities of the issues that may be there, either with investors or with senior employees in particular, where there may be some sensitivities where the CEO may want to handle the situation on their own rather than bring many other people into the loop to solve that problem. Yeah. Having said that, there are lots of highs in which drive entrepreneurs and ensure that their lives are not just lows. So, what are these highs? Yeah, lots and lots of them, right? Winning a large customer, or closing a really big deal, which is hard fought, can be a big win. In the same way as losing a big deal which you felt you were very close to can give you a low. Winning a competitive deal can give you a really big high. Getting funding from top tier investors, especially at valuations which are very rich and very attractive, gives you a huge high. In 2019, Citius Tech became a unicorn, right? So we became India's first healthcare technology unicorn, and we were the 25th unicorn at an overall level. And when we crossed that milestone, that was a huge personal accomplishment for all of us in the management team. And as the founder and CEO of the company, you feel really good at having accomplished something which was quite meaningful. Yeah. We've spoken about the lows, we've spoken about some of the highs, but it is the business of being an entrepreneur or a tech entrepreneur is often beyond that. And there are many other stakeholders who get involved directly or indirectly. And one of the biggest stakeholder, often not regarded in the equation, is the family. Yeah. And to give you a personal example, when I was running the company for about 20 years of my life, I was living in India. All my clients were in US and Europe. And I was back and forth between India, US, and Europe about 10 times a year. And for many of you all who have taken the intercontinental flight, you know that each time you show up from India to the US or the other way around, you need a couple of days to just recover from the jet lag and just get back into a routine. And when you're doing it so many times, I probably was jet lagged about 150 days in a year. And that was very, very stressful on the body. It was stressful on the mind. With all the other activities happening in the business, you're constantly on a plane, and that can take a toll on you and everybody around you. You often end up missing many important life events. You are sometimes there for your kids' birthdays, but sometimes you miss it. You may or may not be there for all your anniversaries. But fortunately for me, I was lucky that when some of the most important life events were happening, especially related with family and health issues, etc., I just was lucky that I happened to be always around when I was required. Yeah. So, what's the net of being a tech entrepreneur? I guess the net of being a tech entrepreneur is that it's a fabulous journey. It's got lots of challenges, as I mentioned, but it's got a lot of highs, and it's a tremendously rewarding experience. Obviously, I have a small bias or perhaps a big bias because the venture that I was involved with became quite successful. But I believe that even if the venture had not been successful, I think just the joy of running a company, building a company in a very, very dynamic world of technology just takes a lot out of you. But the flip side is there is just tremendous learning and there is tremendous opportunity for just having impact there. And when all said and done, when I look back and say, what is the thing that gives me the most satisfaction? The thing that gives me most satisfaction is the opportunity to have worked with some really bright people and see their careers evolve and see them become successful, both uh, from a career perspective as well as financially, as the company did well. And then, of course, to see the company, which was really idea on a whiteboard in 2005, really evolve into being the largest digital health company out of India. And that entire sort of journey is something that made all these 20 years of strive and effort really worth it. Yeah. So wish all of you all the very best in your course. Hopefully there'll be some great learnings along the way. And I'm hopeful that many of you all will eventually become entrepreneurs and tech entrepreneurs. And I wish all of you all great success. Yeah.
I'm sure learners, you will agree with me that listening to Rizwan was quite a learning experience. He spoke very candidly about his learnings, what were the things that gave them joy as they were building CTS Tech, what were the challenges that they faced, and this is as real as it gets. Entrepreneurship is a lonely journey. Even if you have co-founders, there will be times that you will wonder who should you talk to, किससे जाके ये पूछा जाए, उनको हमारे जितना knowledge है कि नहीं, शायद उनको कोई bias होगा. You will have all of these kind of questions, but ultimately you will figure out who you need to talk to, and very often it will be one of your co-founders. And one of the things we recommend is that every startup should have at least 2 or 3 co-founders, because one person almost always needs to be fundraising. One person is doing the business side of things, which is the selling side of things, selling, managing, marketing, whatever. And one person is responsible for the product. So product, R&D, manufacturing, and so on, some of which you heard when Rizwan was talking to us. I am now going to use one slide deck which is borrowed straight from Rizwan Koita. It is a Koita Foundation deck. And in this session today, what I'm hoping to do is share some of the healthcare opportunities for entrepreneurs to create startups that Rizwan Koita has done for my students in class. I unfortunately could not get him directly to speak to you on this. We had some time conflicts, scheduling conflicts, but I'm happy to be doing this on Rizwan's behalf, which is to talk about opportunities that aspiring entrepreneurs like you can have in healthcare as far as India is concerned. I also want to say one more thing, that like this, we might cover a couple of more opportunities like sustainability, like perhaps e-commerce or consumer brands. But there are opportunities like this in every sector. And here is a structure, and you can use this structure. Look online. The government of India provides a lot of data in defense, in aerospace, in manufacturing. The government of India puts out problem statements which they think are unaddressed. मतलब अभी तक किसी ने उसको solve नहीं किया है. So you will find such resources available to you if you want to create a startup. And very often the interest is from a domain. आप शायद रोबोटिक्स में काम करना चाहेंगे, या आप प्लैनेट अर्थ के बारे में कुछ करना चाहते हैं, so you want to work in sustainability, or you want to create a consumer brand because you're saying, when I was a 15-year-old, I did not have access to this kind of food, or I didn't have this kind of gaming, मुझे गेमिंग में कुछ करना है. So once you have identified a domain, the suggestion is to read about the domain, and I'm going to show you a structure which Rizwan has put together for us, and you can do the same thing for the domain you are interested in, and then go about finding a gap, a problem statement, something that has not been solved before. Yeah? So this is how Rizwan looks at the healthcare context. Very often, one of the things we find useful to do is to compare a developed market and a developing market. So here we have taken United States as a developed market and India as a developing market. And the first row that you see is GDP per capita, which means what is it, the economic value the country is generating divided by the total number of people in the country. Yeah. So at US, it's like $85,000. India is $3,000. It is a surrogate, not an exact substitute, but it's a surrogate for how much is it that everybody in this country on an average is earning. So you can clearly see that developed countries are 25 times what our country is. More important is the second row, where developed countries have developed countries diseases. So they suffer most of the diseases prevalent in the US or Europe will be heart disease, will be cancer, will be pulmonary. COPD is pulmonary disease to do with the respiratory system, obesity, that is also a disease, and neural diseases like Alzheimer's and Parkinson's. So those are the kind of diseases that developed countries deal with. Developing countries like India deal with a very different kind of disease. They are more pervasive, they are endemic, they are in our system, and this is malnutrition, which is undernourishment, not obesity, undernourishment, tuberculosis, TB, dengue, malaria, chikungunya, diarrhea. Those are so very different. I don't want to use this, but if I say it, it will come alive to you, which is अमीरों की बीमारियां and जो अमीर नहीं है उनकी बीमारियां. So the diseases are also very, very different, and therefore the solutions have to be very, very different. In terms of the infrastructure, how many beds per thousand people, how many doctors per thousand people, how many nurses per thousand people is a good way of understanding, gauging, understanding ki, how developed in healthcare is country A versus country B, and this number seems to be 4 times. So even though our income is much lower, we have reached 4 times or 1/4. So they are only 4 times better than us, which means that we have less catch up to do. EMR is electronic medical records, and it costs the US hospital 1 to 5 million for a small hospital, but in India it can be done at much lower cost, and I'll show you why these kind of things can happen. So the summary of this slide is we have to go a long way to build health infrastructure. We can do it much cheaper than the developed world, and most importantly, we are solving for a different set of diseases than the developed world is solving for. So that's the summary of this slide. We then will tell you that, it's strange, but only 18% of the world is developed. 82% of the world still is in emerging, developing and emerging economies. And these are Asia, these are Africa. So many of these are more populated and have a longer way to go to catch up. So what is the opportunity? So every time an entrepreneur hears about a problem, immediately they think of not a problem, they see it as an opportunity. Problem and opportunity are just two sides of the same coin. If there is a problem a customer has or a group of customers have, it becomes an opportunity for people like you and me who can create startups in that space. So what can we do? We can help accelerate innovation and R&D. We can develop cost-effective solutions because our income levels are much lower than developing countries. The third line is most important, which is that we can create solutions for our kind of problems, not for the global world's problems, but our kind of problems. The last is create fundamentally new solutions to meet market needs. And if we can do that in India, we can reach 82% of the world because they are more like us and less like the developed world. So if there is a summary of this slide, it says that aspiring entrepreneurs like you have a large opportunity in healthcare as far as innovation and entrepreneurship are concerned. What is our advantage? So we have 3 slides on this. The first advantage is how we are unique. We have a large and varied population. Doctors in India get skilled very fast because the number of patients that doctors in India are seeing is many times the number of patients that doctors in Europe or the US or Japan are seeing, because the population is smaller, fewer people are coming to hospitals, and therefore our doctors get skilled faster. So if you look at the comments here, we are saying that we are unique. The kind of health problems that we have, the kind of diseases that we have in the country are different. They are also complex, but we have the advantage of having very skilled resources. Aata hai. Doctors, nurses, medical researchers, clinical researchers, pharma researchers, we don't have a shortage of these resources. So that's our first advantage. The second advantage that we have is हमारे खून में है. We have innovation in our environment. The other thing that the slide is pointing to is there are no large companies working in this space. So startups have opportunities because there is nobody at a large organization trying to solve healthcare problems. We also are good in frugal innovation. In Hindi, we call frugal innovation jugaad, which means we are able to solve for our problems at a significantly much lower cost than the rest of the world. There was a data that was going around when we sent our mission to Moon and to Mars, Mangalyaan and Chandrayaan, and we were able to do that as a country cheaper than science fiction movies that are made in the United States, right? So they make movies that cost more money. We are able to send real people, satellites, spacecraft to the moon and Mars at lower costs than people are making movies for. So that's the advantage that India has. We have skills, we have resources, we have an inherent innovation ability, and we think about doing things at low cost, because then we can serve all of India and not just the top of the Indian pyramid. The third, we are already very digitally inclined. All of you, even before you ask somebody, will first put things into your phone and ask a question. Music is all on the phone. Movies are all on the phone. All your content, all your learning is digital already. The government is also very focused on digital healthcare because it is possible to reach 1.5 billion Indians digitally rather than कि हर जगह पे हम जाके hospital खड़ा करेंगे. There are many consultings that can be done through telemedicine without having to go and set up healthcare services everywhere. The government of India has a great push, and should be music to people like you, because digital solutions are cheaper to build, are faster to build. We can build independent solutions. It is tougher to put up physical infrastructure. So the advantage that we have is we are skilled, we are solving for the problems that our country faces. We are used to looking at things from a cost lens to make it low cost so that it can serve all of Indian society. And we have a very supportive government infrastructure which is interested in digital healthcare. What is the reality of today's India? The first line says care delivery is fragmented. So if you go to a hospital, you get a different kind of service. You go to a small nursing home versus a clinic versus public hospital, private hospital. All of this is fragmented. It is different from each other. So you cannot develop the same solution and hope to sell it to large hospitals, government hospitals, small nursing homes, and OPD. OPD means outpatient department. It means clinics where people don't get treated and have a stay. They are outpatient. They come and meet a doctor and they go away. We do have constraints. The number of doctors is 1/4 on a per capita basis, and that number is smaller and smaller and smaller as we go to rural and semi-urban India. We have a high variability. So whether it's the protocol, what constitutes malaria, all of that, there is very variable documentation. Um, all of these are things that you can look at to solve for. We have a very high volume. Doctors have to treat a high number of patients in a short period of time, which means that technology can actually help them a lot. We have, as a country, language and culture complexity. So any EMR, electronic medical record, cannot be only in English, it has to be in multiple languages. Anything that you do on the insurance front will need to be executed in multiple Indian states at multiple languages. I always say that every problem is an opportunity. So the last one, which is low digitization, which means there are no hospital records. When I take my father-in-law to hospital, I have to call out his last 10 years of records. I carry some, I don't know how many files and go, but very poor digitization. All of these are opportunities which are staring us in our face. So Rizwan Koita put together a list of areas, examples where we can create startups. The first one he said is digital care, which is electronic medical records. We can create workflows for, doctors write prescriptions. Doctors are listening to the patient. Can someone put all of that digitally? Yeah, interoperability and health, meaning does the same electronic record go from the hospital to a physiotherapy unit to the insurance unit, so that there is no transmission loss in this diagnosis and follow-up treatment? We definitely could use AI for decision support. What kind of a cancer is this? How can we look at scan data and make sensible decisions? A lot of that can be done by AI. And it will not take over from doctors, absolutely not. It will support doctors in their decision making. Can folks like you create models for it? Can folks like you create AI support systems for only, let's say, breast cancer scanning? It is as narrow as those kind of fields. The last example that he has given here is chronic care and remote monitoring. Chronic means somebody who is diabetic will more likely than not continue with that condition. If you have a condition of heart disease, it is chronic, meaning it is long lasting, it will stay. But we are not very disciplined as patients. They say that in India, people don't even finish a dose of antibiotics. Antibiotics dose hota hai 5 din ka. You have to take it 10 times. By day 3, you say, ho gaya, enough. So you don't do. So there is a large amount of care that is needed, which is follow-up care, which needs to be done at home and not in hospitals or clinics. And how can that be done digitally? Are there apps that you can develop? Is there a way by which you can build an AI agent that is doing the follow-up with patients, and therefore ensuring that those patients do their routine regimen? ये दवाई दी है, कहा है कि you have to walk for 20-30 minutes a day, you have to do something else. Are you following all of that? And why is that helpful? If the patient follows all of that, they won't come back to the hospital in a hurry. So all of these are some opportunities that you could grab and work on if you have interest in solving healthcare problems in India. Some more, home care, devices. We have devices today that measure all our phones and watches measure. Are there devices that can predict or support a patient who's got a dementia patient or an Alzheimer's patient? Can there be a device that can be used by senior citizens to feel safe? Home health. A lot of the care is going to shift from hospital to home. The other things that are ideas that potentially 1, 2, 3, 4, many of you could work on is how do you automate hospitals. I'm sure any of you who's been at a hospital, a large hospital, knows that it is very manual. एक paper यहाँ से वहाँ जाता है, फिर कहीं और जाता है. The hospital is always like a hustle bustle. How can you automate a workflow? It's called a workflow, which is desk A to desk B, or doctor A to specialist B, to the pharmacy, to home care, to insurance. How can all of this be automated? There is a lot of focus India has on public health. All of us have lived through COVID, so we know what a public health outbreak looks like, and what we need to do is prevent all of those, which means that one individual cannot be responsible. We have to be responsible for the entire community. These are some of the learnings for entrepreneurs, especially in healthcare in India, that Professor Rizwan left us behind. He says that one needs to be patient. Healthcare moves very slowly. Think of a marathon and not a 100-meter dash. He says focus on go-to-market. They are ecosystems. It is not that you do one thing and it will be appreciated. It has to plug and play into multiple connected systems. He also says that many medical health devices are not marketed well. People are either, most likely many of these inventors are very high tech, and so many of this language goes right above customers' head. He says don't get external validation, make sure that you have met enough hospitals, doctors, administrators, patients who have suffered from the problem, insurance companies, etc., who are all part of the healthcare ecosystem. His last comment is, it's very easy to get distracted. You can think of, we've done well with one market, let's take it to the next geography. Malaria is also big in Africa, let's go launch in Africa. All of this is a distraction. So before you launch a new market or you launch a new product, make sure you have spent sufficient time and sufficient energy resources on that one product that you have cracked. Some of these are learnings. I'm going to summarize the healthcare opportunities session that I just did along with Rizwan's work. And the summary is like this. On healthcare, India has a long way to go. We are nowhere near developed markets. If we can crack India's problems, we can take our solutions and go to other countries in Asia, can go to Africa, because the developing population is 82% of the world. Only about 18% of the world is in the developed category. Our diseases are unique to us. Our resources and capabilities are world class, whether it is to do with research, whether it is to do with clinical data, whether it is to do with pharmaceutical resources. We have the skill for it. We also have the mindset for it. So we are innovative in nature. We want to find jugaad, which is frugal innovation at low cost so that it can serve all of society. We have huge advantages, and the government of India is definitely supportive of digital healthcare. After that, we showed you some examples of where you could build a startup, or even if you are already in a healthcare company, some of these are ideas that you could pursue. I'm going to leave you with the thought that just like we put these 7-8 slides together to tell you the larger healthcare and then came to itemized examples that are underserved or they are not served at all, I request you to look at maybe aerospace, maybe space technology, maybe defense, maybe financial technology, fintech, and find ideas for yourself. I'm going to do one more like this, which is sustainability, and leave it to you to look for problems to solve in the other sectors. So thank you. It was good talking to you about healthcare opportunities in India.